All attendees are in listen-only mode.
Good morning and welcome to the Understanding the OASIS eTMF Specification for Non-Technical Professionals webinar. Today we have two speakers. The first speaker is Jennifer Alpert-Polchek, who is the OASIS eTMF Technical Committee Co-Chair and CEO of CareLex. The second speaker is Sharon Ames, who is an OASIS eTMF TC member and Director of Enterprise Solutions at NextDocs. Jennifer will be our first speaker, and I'll toss it over to you.
Thank you, Jane. Good morning, everybody, and thank you for joining us. I want to premise the presentation with the assumption that most of the people attending today, we appreciate you joining us, really have limited to no exposure whatsoever to the eTMF specification and the OASIS initiative that's underway. So this is really intended to be a webinar that gives an overview of what is the purpose of the OASIS eTMF specification, and then how can you get involved in providing input and influencing the ultimate outcome of this the specification. So as I move through these slides, the format we'd like to use today is really to first run through the presentation, and I'm going to ask my co-speaker, Sharon Ames. She's going to jump in from time to time and really highlight specific areas that may need additional points made. So I'm going to talk through the whole thing, and then we're going to allow a good amount of time for questions and answers. And there's no foolish or silly questions, so we really encourage you to ask questions, and we would be happy to address them. This is a whole new area, and particularly for individuals who are professionals in the clinical trials operations, this is an area that really covers some territory that is unfamiliar. And so we really encourage questions, and there are no silly questions. Okay. So OASIS Open is a leading global standards organization for technical specifications. There are some 600 organizations with more than 5,000 individuals as members worldwide. OASIS Open is a global document there are global document management vendors that represent OASIS membership, and they come from all corners of the earth and are large and small companies, and I've listed just a few of the many global vendors who look at document management. The OASIS eTMF TC is open to all, and that's one of the reasons OASIS was selected. It is very much an open process, publicly viewable online. The membership is anyone's able to join and participate on the TC by joining OASIS. And so if you have questions about that or are interested in maybe considering joining, we would be happy to talk to you, as would Dee Shore from OASIS, and you see the email there. Members of the eTMF Technical Committee, and you'll hear me say TC, that stands for the Technical Committee, number quite a few and really represent a wide variety of interests. It's heavy on the technical companies because this specification is really going to first impact the vendors who provide technical resources to the clinical trials industry. So why eTMF interoperability? I think Oracle says it really well. Interoperability is another way to think of it as data portability. It reduces or eliminates the problems of islands of automation and ensures business processes are able to flow from one application to another. If you look at the picture here, the challenge right now is we basically have many players in the clinical trials chain, and many times the vendors and the players are using different systems, and may have different nomenclature even. And so what happens is those systems can't talk to each other. So you have increased costs and time associated with migrating the data within the trial master file. And time is money. And you know, with the costs where they are today, that's a huge issue. So the problem being solved is that as clinical trials are transitioning more and more from paper to electronic systems, you know, we really have the opportunity to build a specification now. It's a standard that would help increase productivity, save time, and make data portability and data reliability, really, far easier for all of the members in the clinical trials chain. Again, the problem is no interoperability, and it's that sharing of clinical TMF information that becomes a tremendous challenge. You know, I've touched on why this is important, but I think to highlight it a little more is essential. The situation today is that we have many vendors, quality vendors doing great work out there, but without a standard, again, the data management approach is constrained. You cannot do the seamless exchange. And this standard is akin to HTML. You may have heard of HTML with regards to the website, you know, the World Wide Web. HTML was a standard that was developed that enabled everyone to, regardless of what was on the back end, to see and read the web. And think of it in those terms. That's what we're doing for the electronic trial master file. Pardon me. Data standards are going to allow the information to be easily shared regardless of what eTMF system is used. And so all of a sudden, systems that couldn't speak before will now be able to speak. And it will offer flexibility, productivity, and enable new capabilities to be available to clinical trials professionals. So with the problem in mind and a solution at hand, we established a goal within the standard, the eTMF standard, of accomplishing a variety of things. One, first and foremost, seamless exchange of digital records between collaborator systems. To define the formatting for the eTMF records to export and exchange between those electronic systems. Facilitate the quality and compliance of data. Enable efficient search, report, and audit of clinical trial data and their associated records, all with the goal of reducing trial time. Some of the guiding principles in developing the OASIS eTMF standard were to not recreate a wheel. There are many standards that exist today that are, think of them as building blocks to creating an eTMF standard for interoperability. So this is really a standard based upon standards, and it's a technical standard. We use open systems approach, which means that this specification is independent of any operating system or software application or computer language. And what that means is that it's not constraining for the vendors and their customers who may have different needs and interests in terms of the operating system or the language that they use. So the point is that we're developing a specification that can be used by many different vendors. It will be able to enable systems to talk, but it doesn't constrain systems. And again, the whole focus is on being an open source and independent resource to the industry. So with standardization, sometimes a concern is raised around, wait a minute, we don't want to get too constrained as a company. We have our own particular needs, and we like to operate a certain way. And that's been factored into the specification. Every company does have unique needs, and so the specification integrates the ability to be flexible by adding or editing organization-specific metadata terms and organization-specific content items. So what that means is there is a standard set of terminology and what we call content types, which are really, think of them as digital files. It could be an image, it could be a record. But then beyond what is considered these basics, we can actually enable organizations to add to that and tailor it to their specific needs. In order to allow the flexibility, there has to be a set of published rules for the metadata editing, and that's included in the specification. I'm going to give you an overview of the architecture, and then we're going to get into the metadata vocabulary. It's really important as we talk about this eTMF standard to remember that it gives, in fact, again, a technical standard for vendors. So really the work of the OASIS eTMF Technical Committee is really focused on the back-end architecture. And the beauty of the standard that's being developed is that we are enabling the vendors to dictate what the end user sees using display labels. So it will be up to the vendors to identify what their customers want and develop their particular services and products around their customer needs. And I think I'll just point out here, when we get to the point of talking about the metadata vocabulary, there is, vocabulary that's used in day-to-day operations for clinical trials. That is distinct from, a little bit distinct from, but parallel to what we're talking about here. The metadata vocabulary that I'm going to discuss in a little bit really pertains to what is going to be used and integrated into the machine code that is used for this specification. Some of the inputs in terms of standards that have been integrated into the specification include regulatory guidelines from the EMA, FDA, and ICH, technology standards, including business process modeling so that users can set up their own business processes, CMIS, which enables additional interoperability, and then digital certificate signing, as well as the ability to do electronic signatures. Some of the vocabulary references that we've drawn on are the controlled vocabularies of Bridge, Carelex, Dublin Core, HL7, NCI Thesaurus, and then we've also drawn on the TMS reference model terminologies heavily. They have some good work there. The controlled vocabulary overview is really to give you an idea of why do we need the controlled vocabulary, why is it different maybe than what you're working with, how does it impact me. Again, I mentioned the concept of HTML. That's a standard that regardless of the content that's seen by the end user, the HTML standard enables multiple and variable back-end languages to be viewed easily and consistently by users. So think of it in those terms. One of the things that the specification draws on is a vocabulary through National Cancer Institute. Their Enterprise Vocabulary Services works with World Health Organization, the UK and US, and the SNOMED standard. There's a whole variety of controlled vocabularies that are curated by the National Cancer Institute Enterprise Vocabulary Services. And so that's what we've drawn on as well. This is, seems a little bit complex in terms of a picture, but the hope is to give you an idea of where our vocabulary and technology fits in the context of an end user. You're out doing your daily operations. You have a system in place, whether it's an electronic system or you're right now on paper thinking of migrating to electronic system and thinking, wait a minute, this whole standard's happening, how is that going to impact us? If you look at the top half of the screen, today, as I showed this portion of the picture earlier, we have different terminologies that are used, or even sometimes maybe the same terminology, but if there's a spacing or something, your machines can't talk. What we're talking about with this specification is developing the back-end architecture that vendors will incorporate that enables kind of it's like translation to occur between systems, eTMF systems. So we've drawn on a whole variety of terminologies that gets integrated into RDF XML code, which is the machine code that allows the systems to speak, and then that gets translated so that even if you have a CRO system that has completely different terminologies or even different language, you have, maybe it's Japanese and you're working with someone in the UK, you can still communicate, the machines can communicate and migrate the data.
So Jennifer, the way you're explaining this, you're going to allow company A to call.
Sharon?
Yes.
Cut out.
Oh. You're going to allow one company to call something one thing, another company to call something another thing, but behind the scenes there's a standard vocabulary that the machines will read.
Correct.
Is that how you're explaining it?
Correct. And the reality is, the machines, there's actually the National Cancer Institute goes through a very careful vetting process and then assigns a code. And so the code is essential to this process as well. So it's really the code, and then it helps the programmers in terms of the terminology. But the back-end terminology is not what's going to dictate the front end. That's up to the vendors and what they decide based on their customer needs to use in front-end terminology. But the magic behind it, if you will, is it enables all these systems to speak, whether they all have the same language, but they have spacing, or they have different, different languages altogether. They will be able to share the data seamlessly.
And I can see this as a great advantage also, like with acquisition. So it's not just sponsor to CRO. It might be sponsor acquiring other eTMF systems or data and being able to incorporate that easily into their current system. Is that another
Absolutely.
good use case?
Absolutely. In fact, that's huge. And I think we'll talk a little bit later about other benefits of the standard once it's fully implemented. But that is absolutely the case, and it's I think once it's implemented, people are going to be pretty excited because how much time and energy is spent on trying to make sure the information got to where it's supposed to go, and is this the right version? And so there's all sorts of standardization to manage that and make it life simpler for clinical operations. So how will this impact me? We touched on that just a little. Bottom line is that the vendors are going to be most greatly impacted up front, and that's the involvement on the technical committee. It's really going to be up to the vendors to implement the eTMF standard. And again, vendors will take their company-specific approach to implementing solutions for the clinical trials industry, solutions that meet their customers' needs. But if, pardon me, vendors who, we anticipate broad vendor adoption over time. And so basically what will happen is all the vendors who base their products and services on the standard then become ones that can talk to each other, and there's a huge benefit there. So the impact on sponsors and CROs is, at this junction, really minor. The longer term, when the standard is implemented, it's going to be about data portability. You remember I talked about interoperability. The more simple explanation is data portability. It's the ease of migrating records between companies and doing it in a way where you know that the quality is going to be retained. You're not losing accuracy and quality along the way. And finally, sites. There's a very limited impact on sites. For now, we really have had discussions within the technical committee about the degree. Obviously, the TMF is not designed for sites, although some of the documents from sites get pulled into the TMF. So, some vendors may opt to design systems that would allow permissions so that there would be a seamless flow, and that could be ideal. But there's all sorts of regulatory and patient privacy issues that, blinding and unblinding issues that have to be managed there, and we're really leaving that to the vendors at this juncture. So again, this is really a standard designed to manage the eTMF. I thought we should give you an overview of where we are with the standard. So OASIS has a very specific set of policies and processes that they mandate technical committees go observe as they're going through and developing any standard. We started last December, and the technical committee has spent about 6 months developing what was first a working draft and then a committee specification draft. And so where we are now is at this public review period. We've released the committee specification draft, and that is what's available for review. And I'll point out that it's really essential for us to get your input now. We will have other public reviews, but the process mandated by OASIS is that we don't just keep reviewing and re-reviewing the same material over again. We will have other public reviews, and during those public reviews, the technical committee will be releasing the whole specification again, but only the elements that have been changed, added, deleted, any modifications will be what are up for public review. So this 45-day period right now, ending August 8th, is essential for people to have the opportunity to give input and feedback on what's currently released for review. And I might add that typically the OASIS recommends a 30-day public review, and RTC opted to actually make it a 45-day public review just to allow more time for the community, the broader clinical trials community. So you can see from this timeline we have a ways to go. It could take from 6 to 18 months to develop the standard fully. And then once it becomes a standard, then it's adopted by vendors and implemented into systems and then rolled out to the community. The eTMF Committee Specification Draft is actually a 3-component thing. You'll see in announcements where you have links, there are 3 elements. The first is a specification draft document. It's a 40-page document. It is chock full of details about the technical standard, and has many details that if you're a clinical ops person that doesn't have a technical background, much of it will be probably not that interesting, but you're certainly welcome to take a look at it. It gives the rules for editing, it provides versioning information, and it also provides things like format. I know that's been a concern for some folks. They've wanted to know, are you going to limit me in terms of the types of document formats? And the answer to that is no. We base the specification on the IANA standard, which has 1,080 different formats. Anything that is commonly used is in that standard, and so there's all those details are in this specification draft document. The second component of the committee specification draft is the eTMF RDF XML machine code. It's really the coding where the metadata gets integrated into that, and it's where the machines really do the talking. And then the final component, and this is probably of greatest interest to clinical trial professionals who don't have a technical bent, it's the metadata vocabulary spreadsheet. And as you pull up the metadata vocabulary spreadsheet, you're going to see all sorts of terms and the definitions, and you're going to see codes, and you're going to see synonyms. And we'll talk a little bit about how you can give impactful comments, and I think we'll revisit this metadata vocabulary spreadsheet and how you can deliver the biggest impact here and provide the influence that you wish to provide. So Sharon, do you want to add anything at this juncture?
Just to plead to everyone to, if you have a passion for TMF, to make sure you get out there and review that metadata, that vocabulary document. And that's very, very important. It's rather large. If you would like to contribute comments to all of it, that would be great. If you only have time to do part of it, that would be fine. Use your tackle your area of expertise, or maybe you could divide and conquer and pair up with some colleagues to review the document. But it's just very important that we get your input, because as TMF business owners, we really value your expertise in this area.
Thank you, Sharon. Yes, and again, the deadline is August 8th. So there's a variety of ways to participate. I mentioned that anyone at any time is welcome to join the OASIS eTMF Standard Technical Committee. And that is really where a lot of the hard work is done, outside of the public review process. We're really hashing through the details. And if you have a great interest, please feel free to join and check in, at least look into it and find out more about the technical committee. But this is about the public review process, and if you wish to participate in that, which we really encourage you to do, there are a variety of links that we will provide. We will upload that. It's actually on OASIS at the eTMF public page right now. It's also posted on the LinkedIn, the OASIS eTMF LinkedIn site, which you're welcome to join. It's open to everybody. And so I point out the zip file because it's one of the more easy links to handle. You actually get all of the documents in one file, and then you can go into the one that's of interest to you. One thing I want to point out is that OASIS has a very specific way that comments are managed. None of the TC members are permitted to accept comments from. So if you know one of the TC members, just sending an email to them, we're not permitted to submit comments on your behalf. And the reason being, we want to make sure there's no translational errors, there's no misunderstanding or miscommunication. So OASIS mandates that all comments are submitted through the comment link that you see at the bottom of this slide. It just requires signing up. It's just subscribing to the comment list, and then you can begin submitting comments. And then what happens is the technical committee is required to review every single comment, to identify a plan of action, whether it's to integrate it, to identify this as a really great idea that could be used in future versions of this specification, or to say, that we hear your comment, but it's really not applicable in this case. But we will respond that we've received your comment, and then once we've gone through and reviewed all the comments, which we have many, we will actually post all of the resolutions to those comments on OASIS as well. So in submitting a comment, again, I mentioned you need to subscribe to the comment list, and we are going to post this. We'll have this up on OASIS. Once your subscription is confirmed, you'll look for your message in your inbox, and then once your subscription is active, then you're able to send your comments to the eTMF comment line. And then, again, if you're interested in learning more about the TC and want to join, we do have the ability of TC members to comment, but they have to comment a little bit differently, as is noted here. One thing I want to point out is how to make an impactful comment. There are, it's always harder to develop something than it is to find things that are, you don't understand this, or it doesn't make sense to me, or why did you do it that way? But as we move forward, we really need folks to focus on the goal is developing the standard for interoperability, and the more specific you can be, the better. So when you're making your comments, it's most helpful to really focus on what is the solution that you think should be here, as opposed to just the criticism. So an example is if we get a comment that says, why is only an FDA-specific regulation cited? Because you're concerned about Canada or Japan. It's more useful to say, add the EMA or the Japanese specifications or regulations, rather. So, by saying specifically what you want us to do, we have a more clear direction about what you're hoping to see happen here. again, being specific, if you have a comment that says, use this field, use this term instead, or this digital signature is not understood. Well, the concept of digital signature is quite broad, actually. There's a lot of technology behind that. So what about that do you not understand? And we can't spend a lot of time and energy explaining digital signature technology. So a useful comment would be, in Section 2, replace enterprise with electronic, because electronic is the more common term that's used. So those are just a couple examples. The other thing is to focus on your area of expertise. This is a very broad specification. It covers a lot of ground, from heavy on technology to terminology, and one of the areas I think that will be of greatest interest to clinical trials professionals is making sure that the metadata vocabulary has the synonyms that you use. So if there's a terminology that doesn't have, it may not be the terminology you like, but it doesn't, all you have to do is add a synonym, and then it can be found. It can be searched on. So that is a way, in a very specific approach, that you can go in and look, see if the metadata is matching what you know that your group uses, and cross-check it against what is there already. Sharon, do you want to add anything to that?
Well, just to clarify what you mean there, if the metadata, if the vocabulary document says, for example, a monitoring visit report, but your particular business calls it a trip report or a visit report, you would like them just to add those additional synonyms into the synonym section. Is that correct?
Yes, Sharon. And so,
not,
I mean,
and not so much, because we wouldn't be changing the vocabulary label probably.
Right. Well,
or we could be.
We could be, but it's actually much simpler to just add the synonyms, and it's actually more helpful because there are probably other people that use that same synonym. So that's where the input becomes very helpful. So as we look at the development of this standard and the specification, right now it's not a standard, it's a specification that's moving toward becoming a standard. It's important to remember that developing a standard is an evolving process. What we've done at the Technical Committee at OASIS is to really put a stake in the ground and say it's time for interoperability of the eTMF. And it's going to evolve, and part of that evolution is through input from you, and then it will evolve further. And even when we get our first version of the standard, we anticipate that this will grow and change and evolve down the line. And again, the biggest implication will be on vendors, but the benefit will be delivered to all. There will be need for ongoing collaboration and input from diverse industry groups and experts, and again, that's the whole purpose of the public review process. And I mentioned the future versions will be surely generated. And during this process, education and implementation training are going to be essential. And so that's part of why we're doing the webinars right now, and you can expect more in the future. And the goal, again, with all of this is to support the changing industry needs. We know that the industry doesn't stand still, and neither should the standard. At this juncture, I'd like to stop. I've done a whole lot of talking. I hope you have found it helpful. Now I'd like to turn it over to all of you who are on the webinar for questions.
Thank you, Jennifer and Sharon. That was great. So I do have some questions. Some of these you touched on, but let's just loop back around. So can you talk about the involvement with HL7 and the consideration of the work that they are currently doing?
Sure. HL7 is a liaison member. So they are working with the technical committee and providing feedback. And I expect that Mead Walker, who is our member, is going to get real involved as we go back and revisit all the comments with respect to metadata vocabulary. HL7 has really been heavily focused on healthcare and EHR, electronic health records, and migrating interoperability of that data more so than the business processes like eTMF. But they're a great partner, and again, Mead Walker is our liaison member and has been involved.
Okay. And speaking of, consideration of other work, you touched on the National Cancer Institute. Can you talk about the benefits of using that vocabulary?
Sure. National Cancer Institute really is a repository for global, controlled vocabularies, and they actually have helped HL7 develop their controlled vocabulary for the medical. I'm sorry, I'm blanking here, for medical devices, and the benefit is they took our controlled vocabulary and really assessed it from a broader health sciences perspective so that we wouldn't run into conflicts and issues down the line. So it really helped kind of take interoperability to another level with regard to the controlled vocabulary that we're using for the OASIS eTMF specification. We find them a great partner. World Health Organization houses their ICD controlled vocabulary there, as do many, many other organizations, including FDA and their 15,000 terms, etc.
Okay. I think the overarching principle here is inclusiveness, right?
Right, right. And it's really about developing, something that's going to be interoperable for the long term and not just in the context of the eTMF domain. While this specification is for the eTMF, we really want to make sure that we don't end up developing a specification that only, that kind of gets stuck within the eTMF. But we actually are keeping an eye on interoperability from a broader perspective, and that's use of NCI.
Okay, great. Thank you. I appreciate that. So a little bit of static here. Does the OASIS eTMF standard support the use of synonyms and alternate names?
Sharon, you want to take that?
Oh, yes, I think I think Jennifer touched on that one. But of course, any alternate name that you can provide us would be very, very helpful. You can put that in your comments when you do the review.
Right, so let's just talk a little bit about some areas of cost and resource saving that can be realized if you use the eTMF standard.
This is Sharon. Yes, huge cost savings if you think about the short-term cost savings, the efficiencies gained through the sharing of the metadata, and you will no longer have to do a large migration of data when you're thinking of bringing in, trials or information from acquisitions or sharing information between partners. I think in the long term, if we think out into the future, this could also be applied to other clinical systems when we're thinking of, other interoperability opportunities. Jennifer, do you have anything to add to that?
I guess, Sharon, those are all great points. The only other thing I would add is that even longer term, one of the benefits of having interoperability is all of a sudden these islands of data are going to disappear. And so from a sponsor's perspective, what becomes available longer term, or a university researcher perspective, all of a sudden you can begin to look at data that has, past clinical trials, which right now kind of sit idle, and you can begin to do some big data analysis of all of your past trials and gain new learnings and new potential treatments out of the data. So there's huge potential learnings and gains down the line, but again, that is a ways off.
Okay, great. Thank you. Those are great answers. So we've got a couple closing ones that we'll round out the webinar with. So, and Sharon touched on this a little bit earlier, but say, for example, I have a limited amount of time to spend on the review. What's the best place for me to focus my attention on right now?
Right. First of all, what's your area of expertise and what you're passionate about? You know, take a look at those things first. If I was looking at a whole spreadsheet, maybe don't start at the top because that might be where everybody else is looking. Maybe start in the middle or at the bottom. And then, as I said before, divide and conquer. Get some colleagues to help you with this. And probably within your organization there are people that have expertise in different areas. If your area is IRB, maybe you want to do that. Maybe it's data management. You know, some of the other areas of the TMF. So just pull some colleagues in and just put your heads down and try to get as much done as you can.
Very good. I think that's really helpful. Okay, so let's go ahead and end the webinar with this last question, and I think this is sort of future forward thinking. So is there an expected time frame for vendors, you know, in general, to adopt the standard? Well, we're not there yet, but let's look into the future. Actually, we do have one more too, so sorry about that. I just got another one. So let's take a pass at this adoption question.
I'll start with that, Sharon. You can weigh in as a vendor. You know, this, like I showed you on the timeline slide, you know, we anticipate it's going to be another 6 months, maybe, could even be longer, to develop the standard itself. And then, of course, it's going to take time for vendors to integrate the standard into their work. Now, some may be already looking at, we have, you know, many members who are vendors on the TC, and they are already looking at this. We know some of the vendors are already implementing. And we know some vendors they're large organizations, they move a little more slowly. They're planning on implementing it, and it will take them a little bit longer. So that's a nebulous answer in terms of actual times, but, you know, it's going to be a good probably year plus out before we see it implemented into vendors. Sharon, would you weigh in on that?
Yeah, sure. I mean, I represent a vendor, and I'd just like to say that just because I represent a vendor doesn't mean that we are moving into immediate adoption of this. I mean, it all has to be assessed, and all the reviews have to be done, and we have to see what the final output is. And I'm sure all vendors will have that same approach before they are adopting these standards as well. So I would think you will see some more action around this, you know, after, you know, maybe this time next year when people are actually talking about whether they're adopting it or not.
Yeah, I appreciate that. You can definitely sense that you guys are proceeding with great care, and I think that's another theme that people should take away from this webinar. So here's a question. We did discuss this a little bit on the past webinars, and I'm not really sure how to ask this in the most efficient way. So this person is asking about doing a side-by-side comparison with and sort of level-setting documents from the DIA reference model. Do you have any advice for them when they're trying to compare and organize the documents, or, you know, get some handle on how to use the resources?
Well, one of the activities that we did in the TC was to attempt to map the reference model back over. Would love some more eyes and some more comments on that. So just ensure that there is a place for every reference model artifact, and vice versa. Take a look at what has been recommended, and does the reference model need to have this in your mind, or perhaps this is something that's really not appropriate for a TMF, and maybe you would like to make a comment that what has been proposed is not a TMF document. So yes, definitely, please do make that comparison with the reference model if that is something that you have some expertise in. Would appreciate that.
the one thing I would add and caution folks on is, there are elements within the specification that unless the TMF reference model adds them, they won't map. So for example, business processes, electronic and digital signatures. There's a whole variety of things that are included in the specification because this is a technical specification. So, as you're looking, just keep that in mind.
Okay, great. So I think that we are at the end here, and I'll just wait one more second to see if I get any more coming in. Okay, so excellent. Jennifer, Sharon, thank you so much. This was a great webinar. And again, for all the folks on, I will be sending a follow-up email with a link to the recorded version, and we will also make the slide set available. I appreciate you taking the time to join us today. Thank you very much.
Thank you, everyone.
Thank you, everyone. Bye-bye.
Bye-bye.